Hello guys, so this is my cheat sheet, and my patient will be my son, Josiah. Okay.
Come in.
Hi, how are you today?
Good.
Good. Okay. My name is Chris. I'll be your nursing student for today. I will make sure I protect my patient privacy. Okay. Can I see your voice? Can you repeat your name and date of birth?
Josiah, June 18th, 2006.
Okay, what's your last name?
Gutierrez.
Any allergies to food, latex, environmental, or new food, latex, environmental, or medication?
No.
No? Okay. How are you feeling today?
Good.
Good. Okay, so I already asked for your name and your date of birth. Where were you born?
Seminole, Texas.
Seminole, Texas. And what's your age?
13.
13. And what's your gender?
Male.
Male. Okay. So, what brings you in today?
My back.
Your back. Is either aching or
Yeah, aching.
aching? I could need to tell a little bit more about that from when it started until now, like what caused it.
I was running
You're ready? Okay, and where exactly? Can you show me where your pain's at?
my lower back.
Your lower back, okay. And does it radiate anywhere else, or is it does it just stay there?
It stays.
Does it come and go?
Yes.
And how do you describe it?
It comes and goes.
Is it achy? Is it throbby?
Aching.
Achy. Okay, and is there anything that makes it better or worse? Is there anything that keeps you, this pain keep you from doing? No, and on a scale of 0, 0 being no pain and 10 being the worst pain you ever felt, what would you rate this as?
7.
7? Okay. Okay, so when was the last, or what grade are you in?
8.
8th grade? Okay, and do you say your financial status is adequate for your lifestyle?
Yes.
Yes, and do you practice any spiritual or religious? You do any? No? Okay, and do you perform any self-care behaviors? No? Okay. Can you tell me how you spend your typical day from the moment you wake up until you go to sleep?
School. And laying down.
Yeah. Okay, okay. How about your sleep patterns? Do you sleep good at night?
Yes.
Okay, and do you take any naps?
Yes.
You did take naps? Okay, and as a child, have you ever had mumps, measles, or chickenpox? No? Have you ever been diagnosed with hypertension, diabetes, or cardiac disease? Has anyone in your family been diagnosed with cardiac disease, diabetes, or hypertension? No? Okay. And when was your last physical exam?
Last year.
Last year. And when was your last eye exam?
Last year.
Last year. Okay. And are your mother and father alive and well?
Yes.
How old are they?
50 and 52.
So who's 50?
My mom.
So your dad's 52? Okay. Alright. Do you know where we're at?
Yes.
Okay. Who's the current president?
Donald Trump.
Who was the president before that?
Obama.
Okay. So who's the current president? Like who's the president today?
Joe Biden.
Okay. Just making sure. I figured. Right. So do you drink? How many days during the week do you say you drink?
Once a week.
Once a week, and on that typical day, how many drinks do you have?
2.
2 drinks. Okay. Do you know who I am?
Yes.
Okay. Who am I?
A nurse.
You're a nurse. Okay. Okay. So on your drinking, do you ever feel the need to cut down? No. Do you feel annoyed when people bring up your drinking? Okay. Do you feel guilty about your drinking?
Yes.
Do you ever have to drink, or do you ever feel the need to drink in the morning when you wake up? No. Okay. So, do you ever feel, in the past 2 weeks, have you felt depressed, hopeless, depressed, or hopeless? No. In the last 2 weeks, have you had little to no pleasure in doing things? No. If indicated, I would do a FQH9 screening on my patient. I follow with these 2 following questions. Do you ever think about hurting yourself? Okay. And do you have a plan to hurt yourself? No. Okay. And since violence is common in our society, we are required to ask individuals these questions. Do you feel safe at home?
Yes.
Okay. And do your parents push, punch, slap, or hit you?
No.
Or push you? No. Okay. And if indicated, I would do a danger screening on my patient. Okay. I think. Okay. So now I am going to be doing your vitals. Have you had anything hot, cold to drink in the last 30 minutes? No. Have you smoked in the last 30 minutes?
No.
No. Okay, so I'm checking your oral temperature. The average temperature is 96.8 to 100.4 degrees. Okay, and just one bite on it. Okay. Okay, while we're gonna get this ready. Okay. So our patient's temperature is 97.9, which is within a normal range. Okay, so I'm gonna go ahead and do your blood pressure. Can you scoot in a little bit for me? Is there an arm you prefer me to use? Okay, this one. Just put it down. I'm just gonna ask you to make sure you keep your feet flat. Try not to move. Have you had any axillary or medullary surgeries on this arm? Okay, and he has no IVs present or fistulas. And make sure to the proper size for my patients. Okay, you just scoot up a little bit more. Sorry. Thank you. Okay. So this is good for his size. Make sure I wrap it around. How's that? Not too tight? Alright. Sorry. I'm gonna go ahead and find your pulse. Okay. Okay, so I'll stop feeling his pulse at 110. So I will make sure that I'll go up to 140. Okay, so I'm gonna go ahead and do my patient's radial pulse, and this is gonna be between 60 to 100 beats per minute. Right here. Okay, so I got 70 for his pulse, which is with the normal range. I'm going to go ahead and do his respiratory. I would let my patient know this. And his respiratory should be between 12 to 20. Okay. Okay, so his respiratory rate was 18, so it's within normal limits. I'm going to go ahead and check your O2 stats, okay? So I would go ahead and clean my patient's fingers and zero. I'll make sure I clean this and the device. And we don't have us work number 10, and I'll put it on my patient's finger, but before I would make sure that he has no acrylic, no nail polish, or metal, or anything that would mess with the reading. Okay. And this, I would expect this to be between 95 to 100. And it is at 99, so his oxygen is good. Are you feeling okay for me to continue with the blood pressure?
Yes.
More. I'm gonna go ahead and I'm gonna make sure that I clean my equipment. Okay. Make sure your feet are flat on the ground, okay? So I'm gonna go up to 140. Okay, so I got 108 over 74. So that is worth it. Normal, the normal one is 120 over 80, but since it's not under 20, more than 20 points, I wouldn't notify the provider. Okay, you feeling good? Mm-hmm. All right. So I'm gonna go ahead and weigh you. Okay. So you can just get on the scale for me. Okay, here's your 142. Okay, and then you can just turn around for me. And I don't have a measure, but I would make my patient stand all the way to the back. Should I measure him? He is 5'5". Okay. So I'm gonna go ahead and check your waist circumference. Okay. You can just step over here. You can be a little bit closer to the camera. Okay. His waist is 30 inches. Okay, and then you can go ahead and have a seat. I'm going to go ahead and convert his height into inches. So 65, and then his weight's 142 pounds. So I'm going to go ahead and multiply 65. 165. I got 4,225. So it's 142. So I'm going to go ahead and divide that. And then I'm going to multiply it by 703. Okay. My patient's BMI is 23.6. 23.6. Okay. Okay, so now you stated earlier that you had pain on your back. Can you feel pain anywhere else?
No.
No? Okay, so if you did, I would make sure I use the PQRRST to get more information over his pain. Okay, so I'm going to go ahead and start with my physical assessment. So I'm going to start off by stating that my patient's head is symmetrical and it goes adequate size for his body. Got my glove. So I'm going to get another glove. I'll pick that up in a little bit. Okay. Okay, so I'm going to go ahead and palpate his head. Make sure I don't, I'm just looking for any abnormal protrusions, lumps, lesions, or dents. Okay, does that hurt? Okay, so his hair is healthy. He doesn't have any dandruff, any lice, and it's fully distributed, nice and thick. His eyebrows are even and symmetrical to his face. His eyes are, there's no sign of redness around his eyes, and they're bilateral symmetrical as well. Can you close your eyes for me? Okay, can you open them? So he's able to fully close his eyes. His eyelashes are fully distributed. Once again, no redness or crust coming out of his eyes. I'm going to pull down. Can you look up for me? Okay, so his conjunctiva is red, not swollen. His sclera is nice and white and moist. I'm going to go ahead and check his ears. Patient's ears, there's no thickness, no lumps, skin's intact, no lesions. His openings are good, normal size. I'm going to go ahead and pull on his vena. Any pain? So let's shut down on his trigger. Any pain?
No.
How about right here in your mastoid process?
No.
No? Okay, so his ears looks good. There's no serum. If there was, I would document what it looked like in the order. Okay, so I'm going to go ahead and do a hearing test with like rubbing my fingers. And wherever you hear the noise, just raise your hand high enough for me to see it, okay? All right. Okay, so my patient's hearing is good. He's able to talk to me, keep the conversations. He's not asking me to repeat myself. He's not saying what or or huh. So it's good. Can you smile for me? Okay. Let me see your teeth. Can you stick out your tongue? All right. So his lips are pink, moist, teeth are all there. They look healthy. His tongue was pink and I saw presence of saliva. And his nasal labial folds are present. Okay. I'm going to go ahead and check his neck. His neck is in a line and direct. Can you extend your head back and your head forward, your shoulder the other side, and then you can just turn your head to the right and then to your left. Okay, so did that hurt? My patient has full range of motion on his neck. On his eyes, I don't see any exophthalmos or endophthalmos. They're not sunken in or protruded out. Can I see your arms so you can put them in front? Right here. Turn. His nails are smooth, round. I see no clubbing. Capillary is less than 2 seconds. His skin is good to his ethnic background. There's no freckles nor patches. It's evenly distributed. I don't see no moles, lesions, or wounds. His skin is, I don't see jaundice, pallor, peakness, erythema. So he is good. His temperature is warm, not hot or cold. Okay, you can put your arms down for me. Have you seen any recent changes in your skin? No. Have you seen any lesions? Do you have any wounds? No. So if my patient did have wounds, I would look for the location, the size, and the exudate date. If my patient had any lesions, I would look for the symmetry, the border, the color, the diameter, and the elevation. If the diameter was more than 6 mm, my patient would need further assessment. Okay, so I'm going to go ahead and check for edema. Okay, no edema. You can just turn your legs this way for me right quick. I'll pull your socks down, okay? Okay, no edema. Can I see your other leg? Thank you. Trying to reach in there, I'm sorry. No edema. Okay, so if I did find edema, I would grade it as 1 plus mild, 2 plus moderate, 3 plus deep, 4 plus very deep. His hair on his eyes was evenly distributed. I'm gonna go ahead and take off my gloves. And did you feel any pain as I was touching your edema or anything? No. All right. Do you have any questions for me or concerns? Okay. So I'm going to go ahead and do your smell and eye chart. This is, I don't have a full-size chart. I'm going to be using this, and I'm just going to have my have my patient hold it about 12 to 18 inches away from his face. Okay, so just get that for me. Okay, and can you, what's the smallest line you can read? Okay, read it for me.
D-E-F-P-O-T-E-C.
Can you cover your right eye?
D-E-F-P-O-T-E-C.
Okay, now let's switch hands. So like hold this with this, or I'll hold it for you and then cover your other eye. Okay, cool. And can you read that for me?
D-E-F-P-O-T-E-C.
Okay, so in my patient's reading was poor than 20/30, I would refer him to ophthalmologist. My patient's cognitive is good, my patient's appearance is good. He is clean, he has good hygiene. His gait to and from weighing him was good. I didn't see him with an unsteady gait. His behavior was good. He doesn't seem confused. He is oriented to the time and place and to the person. His speech was not slurred. It wasn't too fast. It was clear. He was able to keep a conversation with me. He isn't suicidal and has no trouble communicating with me. Okay, so we're done. Thank you. Okay, so this is my